I'm Barbara Bowness. I work in the National Leadership and Innovations Agency for Healthcare, and I am taking the lead on implementing part one of the Mental Health Wales measure. My colleague John Roche is the project officer for the mental health legislation team in the Welsh Assembly Government, and because we've got slightly longer to give you this presentation this morning than we anticipated at first, John is going to take you through parts 2, 3 and 4 of the measure, so you'll get a feel for all of the measure. And what we want to do is to explain what it's about and also where we are in terms of implementation. I was actually in the Hilton yesterday, and I just had a look in the ballroom, and I have to say it looks an awful lot different today than it did yesterday when it was empty, and it's great to see so many people here who are interested in progressing services for people with mental health issues in primary care. The Mental Health Wales measure, very long title, received royal approval in December 2010. And the different parts of it are going to be implemented incrementally across Wales, and all phases need to be implemented by March 2013. So, 2 years less a bit sounds a reasonable length of time, but there is a considerable amount of work to do to get to that point. And, when we talk through the implementation, you begin to appreciate the level of work that's involved. The measure itself looks like this, and I'm sure you can't see that from there, but it's quite a dry document. If anybody's particularly interested in working through it, there is a link to the measure through the Wales Mental Health in Primary Care Network website. So the measure itself has got 4 purposes. The first is to expand the provision of primary mental health services. The second is to ensure that all service users within secondary care have a care coordinator and a care plan. So that's about extending the care planning approach. The third part is to give re-access back into services for people who've been discharged from secondary care services. And the fourth part is around expanding independent advocacy to all inpatients and inpatient community sections of the Mental Health Act. Part 1, as I said, is about the provision of of local mental health support services in primary care. And these will be driven, if you like, by joint schemes which will be agreed between local health boards and local authorities. So the focus of each scheme is on a local authority area, and the measure is very clear that it's a joint responsibility between local health boards and local authorities. So they are the partners to the scheme. The onus is on them to draw up a scheme, and the measure provides contingencies for if those partners are not able to agree a scheme. The people who will be able to access these services will in the main be registered with a GP. So the criteria for access will be, in the main, that people are living within the local authority area of the scheme and are registered with a GP. And the schemes will set out the details of the services that are going to be provided and how the services will operate. The schemes must cover all people of all ages who are registered with a GP in that local authority area. So that's a very broad catchment, and I'd emphasise all people of all ages. So it literally is age blind. And when we're thinking about implementation, we need to think about children and young people as much as we do adults and older people. And the schemes must cover all people who are set out in the regulations. And this is where it begins to get complicated, because regulations are secondary legislation linked to the measure, and regulations will be developed so that people who are not registered with GPs may access these services. And those groups are likely to include prisoners, students, homeless people, gypsies and travellers and so on. So you begin to see that that initial clarity about who's included is beginning to get less clear. In addition to that, the local schemes may cover people who are subject to the 1983 Act, people who are in secondary mental health services, and other people who may not be entitled. So as you'll have guessed, the must do is a must do, the may do is for local discretion. So the meaty bit then around what are local primary mental health support services. First of all, and these are set out in the measure under section 5, that these services will provide assessments of people who are referred into it either through GPs or through secondary care if the local schemes allow. The second requirement is that these services will provide some treatments or interventions. And the thinking is that these will be short-term, possibly limited to 6 or 10, but by no means prescriptive around that, for people who will benefit from that type of intervention at that type of level. The services will also make referrals on to other services if somebody comes into these local primary mental health support services and it's felt that their needs are better met elsewhere. So they might be referred on to secondary care, or they might be referred or signposted on to other agencies such as third sector services. The fourth part then of the service role is to provide information, advice and other assistance to primary care providers. And this is really to support general practitioners and primary care staff to help them and to work with them to manage more people more effectively in primary care. So there's a big educational role in this service delivery as well. And then the fifth part, as I've already alluded to, is around signposting and providing advice and information to patients and their carers. It's expected that these services will be delivered alongside or close to primary care, either within general practice or close to, and it's expected that they won't be developed in isolation. So where primary care mental health services are already in existence for whatever age group, it's expected that that will be taken into account when these services are set up so that we avoid any duplication and gaps in services. And it is possible that in the scheme, the local authorities and local health boards might seek third sector partners to provide some or all of the services. Another point to emphasise around the actual service delivery is that these new services under the measure are not the only route for services for people with mental health in primary care. So GPs may feel that it's more appropriate that they manage all their care and treatment, or GPs may recognise at the outset that the local new services are not going to be appropriate and might refer them straight to secondary care. So you've actually got three options: being seen and managed solely by the GP, being referred to the new services, or being referred to secondary care directly. And of course they're not mutually exclusive, so there could be combinations of any of those. The work that we're doing around implementation is with a view to these services being up and running by summer 2012. But the absolute deadline is that all these services must be up and running by March 2013. And to support this implementation at national level, a number of initiatives are underway. We have recommended, or the Assembly has recommended to local health boards and local authorities that they appoint a local implementation lead, and has indicated that there will be funding available to support this appointment. There's been considerable work already undertaken to develop a national service model, which is expected to be released very soon, and that will provide the foundation for the service, and it'll set out the expectations of what's required from service delivery. Another big piece of work which is being led nationally is to coordinate a mapping exercise across Wales to understand the current profile of mental health services in primary care. And what we're looking to do from that is to understand what services are already out there, who they're delivered by, who they're delivered for, how people access them, what the availability is, what performance measures are in place, and to pick out staffing skills, and also to identify any areas of notable practice that we might want to share across Wales to support the implementation of the services under the measure. Alongside that, we're profiling the GP practices in terms of where they're located, how many partners they have, what their catchment population is. And I know that that information is fairly widely available already, but we felt it was useful to draw this into the mapping exercise. Alongside that, we're profiling the GP practices in terms of where they're located, how many partners they have, what their catchment population is. And I know that that information is fairly widely available already, but we felt it was useful to draw this into the mapping exercise. And then the final part of the mapping is to understand what we're calling special groups or distinctive groups who may access services but may not be registered with the GP, prisoners, students, homeless, gypsies, travellers and so on. And that information will help to inform the regulations that I mentioned earlier. And then the third set of regulations will be around what we're calling regional provision. And that's where one or more local authorities want to come together with a local health board partner or partners to develop a scheme. So the scheme may cover more than one local authority area, and that needs to be confirmed through the regulations. And then finally, under the what I call big chunks of work, is developing guidance for local authority and local health board partners to inform their preparation of their schemes. And the target for that is around October 2011, because I feel that without that it's going to be very difficult to actually focus on developing the detail around these services. If I come on to the thorny issue of funding, which is where everybody's ears pick up, you might recall that as the measure was going through the different stages in the National Assembly, there was a supporting explanatory memorandum which gave a lot more detail and set out the impact of the different sections. And that explanatory memorandum said that there would be pre-implementation funding of £500,000 made available during 2011-12. So that funding is available to support the appointment of the implementation leads and also other non-recurring implementation work. And the explanatory memorandum also said that there would be recurring annual funding of £3.5 million available from 2012-13 onwards. And I have to be very careful what I say about this, because nothing has rescinded that explanatory memorandum, but that money will be released subject to ministerial approval. So I'm personally not anticipating any issues with that, but just so everybody knows that that's not guaranteed. And that will then be available to support the ongoing delivery of these services in primary care.